When I speak to women over 50 about their health, there's one topic that often gets brushed aside, sometimes out of embarrassment, sometimes out of the belief that it's just part of getting older. I'm talking about vaginal health. The truth is, the changes that happen after menopause are not simply cosmetic or minor annoyances. They can affect comfort, intimacy, urinary health, and even confidence in everyday life. And ignoring them doesn't make them go away. In fact, it often makes them worse. The good news? With the right habits and attention, you can maintain and even improve vaginal health well into your later years. After 50, estrogen levels naturally decline, and this drop has a direct effect on the tissues of the vagina. The lining becomes thinner, less elastic, and produces less natural lubrication. For some women, these changes happen gradually, and they barely notice them at first. For others, the difference is dramatic. Intimacy becomes uncomfortable. Even daily activities like walking or sitting for long periods can lead to irritation. But here's the most important thing I want you to hear. This is not something you have to simply accept. These changes are biological, yes, but they are not irreversible when addressed early and consistently. The reason I call vaginal health the hidden cornerstone of women's health after 50 is because it touches so many aspects of life that most people never connect. Discomfort or dryness can lead to avoiding intimacy, which can strain relationships. Weakening of pelvic floor muscles can cause urinary leakage, which may lead to social withdrawal. Even recurrent infections, something many women chalk up to bad luck, can be linked to changes in the vaginal environment after menopause. And once a woman starts avoiding certain activities or situations because of these issues, her mental health can also be affected. This is why I tell my patients, caring for this part of your body is not about vanity, it's about quality of life. The first step is awareness. Many women hesitate to bring up symptoms with their doctor, thinking it's too personal or that it's not worth bothering anyone about. I assure you, as a physician, I would rather you mention even the smallest change than stay silent and let a problem grow. Pain during intimacy, frequent itching or irritation, new urinary issues, or even a subtle feeling of dryness. All of these are worth discussing. They're not just aging. They're your body telling you it needs support. I also want you to think of vaginal health not as a separate category, but as part of your whole body wellness. The same habits that keep your heart, skin, and joints healthy will also protect and nourish your vaginal tissues. But there are also specific practices that make a big difference here. In the coming parts, we're going to cover everything from proper daily hygiene that supports your natural balance, to hydration and diet choices that make your tissues healthier, to exercises that strengthen your pelvic floor and protect against long-term discomfort. One of the most common misunderstandings I encounter is the idea that vaginal health after 50 is purely about cleanliness. In reality, overcleaning is one of the biggest causes of irritation and discomfort I see in my patients. The vagina is a self-cleaning organ. It maintains its own delicate balance of bacteria and pH. When that balance is disrupted, problems begin. Dryness worsens, infections become more frequent, and even the tissue itself can become more fragile. Harsh soaps, scented washes, douching, all of these strip away the protective environment your body has worked so hard to maintain. If you want to protect your vaginal health after 50, the first rule is simple. Be gentle. Warm water and a mild, unscented cleanser for the external area, the vulva, are all you need. Nothing more. Another area women often overlook is hydration. And I'm not just talking about drinking water for your overall health. Proper hydration supports your body's natural ability to maintain healthy mucous membranes, including those in the vaginal tissue. Dehydration can make dryness more pronounced and make intimacy uncomfortable. I encourage my patients to aim for steady hydration throughout the day, not just gulping down water when they feel thirsty. Herbal teas, water-rich fruits like melon or cucumber, and avoiding excessive caffeine or alcohol all help maintain tissue elasticity. It may sound simple, but the results can be felt surprisingly quickly. Then there's the role of diet. After 50, your estrogen levels drop, and certain nutrients can help your body adapt to that change. Omega-3 fatty acids found in fatty fish like salmon, flax seeds, and walnuts help reduce inflammation and improve blood flow, both crucial for tissue health. Foods rich in vitamin E and antioxidants support the repair and resilience of the vaginal lining. And let's not forget probiotics, both from fermented foods like yogurt and kefir and from targeted supplements. A healthy gut microbiome directly supports a healthy vaginal microbiome, lowering your risk of infections and helping maintain the right pH balance. Physical activity also plays a surprisingly large role in vaginal health. Regular movement improves blood circulation, and better circulation means better oxygen and nutrient delivery to tissues, including the pelvic region. But here's where I want you to be intentional. Add pelvic floor exercises to your routine. Kegel exercises, when done correctly, strengthen the muscles that support your bladder, uterus, and vagina. These exercises help prevent urinary leakage, improve sexual function, and even enhance sensation. The key is consistency. Just a few minutes a day, done properly, can lead to noticeable improvement within weeks. Finally, I want to address a point that many women don't realize until it's too late. Neglecting vaginal health doesn't just impact your present, it shapes your future comfort. Women who care for their tissues, maintain muscle tone, and protect their microbiome in their 50s often enjoy far fewer problems in their 60s, 70s, and beyond. Think of it like caring for your joints or your skin. What you do now determines how well your body serves you in the years ahead. So, rather than waiting for symptoms to appear, I urge you to start protective habits today. The earlier you begin, the better your long-term results will be. One of the most common and frustrating changes women over 50 face is vaginal dryness. For many, it's not just a mild inconvenience, it can turn intimacy into something they avoid altogether and make even simple daily activities, like walking or sitting for long hours, uncomfortable. This dryness is a direct result of declining estrogen, which normally keeps the vaginal lining thick, elastic, and well lubricated. As estrogen levels drop, the tissue becomes thinner and more fragile, and natural lubrication decreases. The problem is that too many women assume nothing can be done about it, or they resort to quick fixes that don't address the root cause. The truth is, there are multiple strategies, both medical and lifestyle-based, that can restore comfort and protect your tissue for years to come. The first thing I recommend is distinguishing between two categories of products: lubricants and moisturizers. Lubricants are designed for temporary relief during intimacy. They reduce friction and make the experience more comfortable. Moisturizers, on the other hand, are used regularly, regardless of sexual activity, to maintain hydration in the vaginal tissues over time. Many women only use lubricants and wonder why the dryness persists day to day. The real solution often involves adding a quality vaginal moisturizer into their routine. Look for products that are water-based, free of fragrances and parabens, and ideally formulated for sensitive tissue. When it comes to lubricants, I advise my patients to choose wisely. Water-based lubricants are safe and versatile, but may need to be reapplied during longer intimacy sessions. Silicone-based lubricants last longer and can be especially helpful for women with more severe dryness, but they should be used with care and avoided with certain silicone toys. Oil-based lubricants should be approached with caution. While some natural oils, like coconut oil, can be soothing for external use, they can disrupt the vaginal microbiome or degrade latex condoms. A conversation with your doctor or gynecologist can help you choose the safest option for your needs. Beyond topical products, lifestyle changes can make a meaningful difference. Hydration, as we discussed earlier, plays a key role, but so does circulation, and that's why regular movement and pelvic floor exercises remain essential. Increased blood flow to the pelvic region brings oxygen and nutrients that help maintain tissue health and responsiveness. Even something as simple as a 20-minute daily walk can improve pelvic circulation and support better natural lubrication over time. For women who want a more targeted approach, local estrogen therapy can be a game changer. This involves applying a low-dose estrogen cream, tablet, or ring directly inside the vagina, which restores the tissue's thickness, elasticity, and moisture without significantly affecting the rest of the body. Many of my patients are amazed at how quickly they notice improvements, sometimes within just a few weeks. It's a safe and highly effective option for most women, but it must be prescribed and monitored by a healthcare provider, especially if you have a history of hormone-sensitive conditions. Lastly, I want to address a crucial point. Dryness and discomfort are not just physical issues, they can have a profound emotional impact. I've seen women withdraw from intimacy entirely because they associate it with pain, and over time, this can erode closeness in a relationship. My advice is to be open with your partner, explaining that this is a medical and hormonal change, not a lack of interest. Working together to find solutions, whether it's experimenting with products, adjusting timing, or incorporating more non-penetrative forms of intimacy, can protect both your physical comfort and your emotional connection. Remember, the goal is not just to avoid discomfort, but to preserve and even enhance your sense of pleasure and connection as you age. If there's one thing I wish every woman over 50 knew, it's that pelvic floor health is directly tied to vaginal health, and it's never too late to strengthen it. These muscles, located at the base of your pelvis, support the bladder, uterus, and rectum. They help control urination, maintain healthy vaginal tone, and even enhance sexual sensation. But with age, hormonal changes, and sometimes childbirth injuries from decades earlier, these muscles can weaken. The results can be frustrating. Urinary leakage when you sneeze or laugh, a feeling of heaviness in the pelvic area, or decreased sensation during intimacy. And here's the hard truth. If you ignore this, the problem rarely stays the same. It usually gets worse. The good news is that targeted exercises can reverse much of this decline. The most famous of these are Kegel exercises, contracting and relaxing the pelvic floor muscles to build strength and endurance. But here's where many women go wrong. They either don't do them regularly or they do them incorrectly, sometimes straining the wrong muscles. The easiest way to find the correct muscles is to imagine stopping your urine midstream. Those are the muscles you want to engage. Hold the contraction for about 5 seconds, then relax for 5 seconds. Start with 10 repetitions twice a day, and gradually increase the length of the hold as your strength improves. For women who struggle to feel these muscles or want faster results, there are additional tools. Pelvic floor trainers, vaginal weights, and even certain forms of biofeedback can help you identify and engage the right muscles. In my practice, I often recommend working with a pelvic floor physical therapist for a few sessions. This guidance ensures you're training effectively and safely. Many women notice improvement within a month, and the benefits go far beyond preventing leakage. better blood flow, improved tissue health, and enhanced sexual responsiveness. Strengthening your pelvic floor isn't just about exercise, it's also about protecting these muscles from strain. That means managing your weight to reduce pressure on the pelvic organs, avoiding heavy lifting without proper technique, and treating chronic cough or constipation, both of which can weaken pelvic support over time. Even your posture matters. Slouching can place unnecessary stress on the pelvic area, while good alignment supports muscle function naturally. I also want you to think of pelvic floor care as an investment in your future independence. Many women don't realize how common pelvic organ prolapse, when organs shift downward into the vaginal canal, becomes later in life. It's not inevitable, and strengthening the pelvic floor is one of the most effective ways to prevent it. When you protect these muscles now, you're not just preserving comfort and intimacy, you're safeguarding your ability to move freely, stay active, and live without embarrassment in the decades ahead. Finally, remember that pelvic floor health and vaginal health work hand in hand. Strong muscles improve circulation, which nourishes the vaginal tissues. Healthy tissues, in turn, make intimacy more comfortable and enjoyable, encouraging you to maintain the kind of physical connection that keeps these muscles engaged. This is why I tell my patients, every time you brush your teeth, do a set of Kegels. Make it part of your daily rhythm, and your body will thank you every single year that follows. One of the most overlooked aspects of vaginal health after 50 is maintaining a balanced and resilient microbiome, the community of beneficial bacteria that live in and protect the vaginal environment. When this balance is disturbed, harmful bacteria or yeast can overgrow, leading to discomfort, itching, burning, unusual discharge, or even recurrent urinary tract infections. For some women, these changes start subtly after menopause, and for others, they seem to appear overnight. But the truth is, the shift in estrogen levels and natural lubrication changes the chemistry of the vagina, making it easier for infections to develop if we don't take proactive steps. The first principle I teach my patients is to avoid anything that disrupts this natural balance unnecessarily. We already discussed avoiding harsh soaps and douches, but it goes beyond that. Scented pads or panty liners, synthetic underwear that doesn't breathe, and tight-fitting pants worn for long hours can all create a warm, moist environment that allows harmful bacteria or yeast to thrive. I recommend wearing breathable cotton underwear during the day, avoiding prolonged dampness, for example after swimming or exercise, and giving your skin a chance to breathe at night by sleeping without underwear when possible. Probiotics are another valuable tool in maintaining vaginal health after 50. While many people think of probiotics only for gut health, certain strains, like Lactobacillus rhamnosus and Lactobacillus reuteri, specifically support vaginal health by promoting the right pH and preventing harmful bacteria from multiplying. These can be taken as supplements or obtained from foods like yogurt, kefir, sauerkraut, and kimchi. For women with recurrent infections, I often recommend a combination of dietary probiotics and targeted supplements to strengthen the microbiome, both in the gut and vaginal tissue. Hydration and diet also influence infection risk more than most women realize. A diet high in processed sugar can feed yeast overgrowth and increase inflammation, while staying hydrated supports your body's natural cleansing systems. I encourage replacing sugary snacks with fiber-rich fruits, vegetables, and whole grains, which stabilize blood sugar and reduce infection risk. Including anti-inflammatory foods like berries, leafy greens, and fatty fish helps keep tissues healthier and more resistant to irritation. There's also a connection between sexual activity and vaginal health that should not be ignored. Sexual intimacy, whether with a partner or through self-stimulation, increases blood flow and helps maintain the elasticity of vaginal tissues. However, sexual activity can also introduce new bacteria into the vaginal environment, so hygiene is essential. This doesn't mean aggressive cleaning. It means gentle washing before and after intimacy, staying well lubricated to avoid micro-tears, and emptying the bladder afterward to reduce the risk of urinary tract infections. Finally, I always remind my patients to pay attention to early signs. A small change in discharge, mild irritation, or increased urinary urgency might not seem worth mentioning, but catching and treating these changes early prevents bigger problems later. After 50, your body's recovery processes are slower, so prevention and prompt action are far more effective than waiting for symptoms to become severe. Think of it like tending a garden. If you care for the soil and remove weeds while they're small, the whole environment thrives. The same applies here. Protect the balance, nourish the tissues, and you'll enjoy comfort and confidence for many years to come. When we talk about vaginal health after 50, it's easy to focus only on the physical aspects: dryness, infections, muscle tone. But I've learned over decades of practice that lasting wellness comes from a combination of physical care, emotional well-being, and consistent preventive habits. Your vaginal health is not isolated from the rest of your body, and it is certainly not disconnected from your mind and relationships. In fact, I've seen women who made physical changes but still struggled because they overlooked the emotional side of this transition. Addressing both is the only way to create a sustainable improvement. Emotional well-being plays a surprisingly large role in vaginal health. Chronic stress can disrupt hormone balance, reduce blood flow, and even lower libido. Anxiety or embarrassment about changes in your body can lead to avoiding intimacy or medical appointments, which in turn allows problems to grow unnoticed. This is why I encourage my patients to view this stage of life as a time for open conversations with partners, with friends, and with healthcare providers. The more you normalize these discussions, the easier it becomes to address concerns early and without shame. Regular medical checkups are also a cornerstone of prevention. I advise women over 50 to have a pelvic exam at least once a year, even if they feel fine. This isn't just about screening for cancer. It's an opportunity to discuss any changes in comfort, lubrication, muscle strength, or urinary health. A good doctor will not only look for problems but will also guide you in maintaining your health, adjusting your care plan as your needs change. If your current provider brushes off your concerns, don't hesitate to find one who takes them seriously. Your comfort and health are worth it. I also remind my patients that relationships, both with themselves and with others, can deeply influence vaginal health. Positive sexual experiences, whether partnered or solo, can maintain muscle tone, elasticity, and blood flow. Touch, affection, and a sense of connection reduce stress hormones and increase oxytocin, which supports tissue health and emotional well-being. And for women who are not sexually active, self-care practices and gentle stimulation can still provide many of these same benefits. Long-term success comes from building a routine that becomes second nature. Daily pelvic floor exercises, mindful hydration, a nutrient-rich diet, and regular movement should be as automatic as brushing your teeth. Add to that periodic use of moisturizers or lubricants as needed, ongoing attention to your microbiome, and open dialogue with your healthcare provider. And you have a complete system for protecting your vaginal health. These habits don't just prevent problems, they allow you to live without the constant background worry of discomfort, leakage, or infection. If I could leave you with one message, it would be this: your body is still capable of pleasure, comfort, and vitality after 50, but it needs your attention and care. You are not too old to improve your health. and you are certainly not beyond the point of change. Every positive step you take today builds a stronger foundation for the years ahead. Treat your vaginal health as an essential part of your overall wellness, and you'll not only feel better physically, but also more confident, connected, and alive. And if these insights have helped you, I encourage you to continue learning, to take action now, and to make your health a priority, because you deserve to thrive in every stage of life.